A prominent doctor, meanwhile, in California says he was fired after questioning stay-at-home orders in Contra Costa County before the state mandate. He says the lockdowns did more harm than good and caused needless suffering, pointing out a letter to county officials, health officials. The science is clear that more lockdowns lead to much more non-COVID morbidity and mortality. He joins us now. Dr. Michael Debloisblanc was removed from his post as Trauma Medical Director for John Muir Health. Doctor, good morning to you and welcome. Tell us your story. What happened?
Hi. Yeah, good morning, Sandra.
Good morning.
Thanks for having me on. Yeah, no, it's been a crazy week or so. A group of parents that we were working with to try and discuss these issues with the county was going back and forth, trying to get our kids back in school. And the county was really not responding to any of their requests. And so they approached us and said, hey, would you mind writing a letter to the county to maybe explain some of these issues? All the data that I'm aware of looking at children and the virus shows that it's safe. I mean, there's many other states now that have months of a track record showing that it's safe for their kids to go back to school. And the state of California and the county is just not making that possible. So, we were trying to convince them to get our kids back in school. And then there was some spin-off questions that, were regarding small businesses and restaurants that were closing.
Mm-hmm.
These are restaurants that are, just trying to survive and keep their doors open. Yeah. And, it's been very difficult for them.
Let me dig into two of the things that you took issue with and that you just mentioned there. Outdoor dining, for example.
Yeah.
On this program, we had Dr. Gerard, who made a lot of news when he said, yeah, I don't really understand that. When California shut down their outdoor dining, he said the science does not show. He said he does not have evidence that shows that outdoor dining is it concerns him as a method of spread of the virus. So he was pointing out the science opposite of what the state was in shutting down those restaurants when it comes to kids in school. The top health officials say that's, in some cases, the safest place for kids to be because they're masked and they're social distance. So you pointed this out, and then you've been let go from the hospital. Did they give you a specific explanation for that firing?
Well, it was clearly related to the letter.
But did they say that?
But I have not had.
Did they provide that explanation?
It was within a week of doing that, and no, they have not put that down in writing. But that's pretty clear. But this really isn't about me and my job with John Muir. It's this is that's a great hospital. They're doing amazing things. The doctors and nurses there taking care of COVID patients are risking their health every day. They just got the first round of the vaccine, and let me tell you, it's a big relief for them because they can come to work with just a little bit more, confidence that, they're going to be safe. This is really about the community and how, we need to, not make this worse. This is a terrible disease. I mean, it's killing a lot of people. There are excess deaths, and it doesn't need to be made worse.
There is a lot of doctors that are questioning some of these things that health officials have very clearly said in some cases are not a problem. The NBC Bay Area says that they did get a response. A statement was released to them from the hospital by which you were fired. The doctor is employed through an outside contract, it said, and after careful consideration, John Muir Health is not continuing with Dr. Debloisblanc in that position. Wanted to make sure that I put that out there. These are the county health officials pushing back on your concerns about the lockdowns. We'll put it on the screen. All of these orders have been based on strong science and good data. The doctors are citing data that our health department believes is not reflective of accurate current thinking. So based on the two things we just discussed, was there anything else that you wrote about or that you showed concern with where you differ with the known science out there or the top healthcare officials at the federal level?
Well, I mean, the letter was written as a personal letter, and a simple email response to some of our questions back to us would have probably been adequate. One of the things we talked about is the PCR testing issue. I mean, PCR testing is a highly sensitive test, but the specificity is not perfect, meaning that there are a fair number of false positive tests. They're doing over 8,000 tests a day in our county. And just the false positives alone on that will put us in the highest tier. And being in the highest tier, our kids can't go back to school.
What are you suggesting is the false
I mean,
positivity rate of a PCR test?
Well, it's probably anywhere from about 1 to 4%, meaning that about 1 in 100 tests might, that come back positive is incorrect.
That sounds like a pretty low percentage of false positives. Is it not?
It is. It's low, but when you multiply that by 8,000, the number is significant.
Okay. I'll just finish off with this up on the screen. You're saying excessive testing. To your point just there is what you're questioning. ICU capacity, you're pointing out, it's been stable since July 1st. You're also writing about hospitals testing all incoming patients, captures more asymptomatic disease, and the CDC and Pediatric Societies support opening schools, to which we spoke as well. Doctor, good to have you on here this morning. We'll follow up with you. Did you have a quick final thought?
No, have a good holiday season. I wish you well.
Thanks, Doctor.
Get your vaccine.
Okay. When it's available to me, I will. Thank you.
Yeah, it will be soon.